Hello, ARF.com. This is Dr. Stacey Wallach from Town & Country Veterinary Hospital in Town & Country, Missouri. Today we're going to talk about a common thing they hear a lot about in humans, their ACL ligament tears. So most people know that's an injury to the knee. We hear a lot of the sports people, football, baseball players having these injuries. Dogs get it too. In dogs we call it a cranial cruciate ligament instead of anterior cruciate ligament, just because the anatomy is a little bit different, but it's the same thing. That ligament is in the knee joint, so this is a model of a knee. This is our femur and our tibia here, so this is our knee joint. This is our little kneecap here. And when we move that out of the way, this ligament right here is your cranial cruciate ligament. The reason they're called cruciate is because there's two of them and they cross like this in the knee, okay? And it's usually the front one, or the cranial cruciate, that ruptures. And how does this happen? Well, a lot of times it's from a traumatic incident. So they're running and they twist, they maybe step in a hole, or they turn quickly and they twist that knee and that ligament can rupture. But a lot of times in dogs there's a degenerative component to that. That ligament will wear down over time and it doesn't take that much of an injury to actually cause it to rupture. One of the reasons that animals are predisposed to cranial cruciate ligament injuries is because a lot of dogs are overweight. So having a slim dog is going to be one way to prevent this from occurring. How do we diagnose it? Well, one, the dog comes in lame, usually on one of the back legs, and then you bring it in to see a veterinarian, and we do what's called a cranial drawer test. So we have the animals either stand up or lay on their side, and we kind of just hold it in a specific way that when we move the knee, we can get this kind of a motion. That knee will move backwards and forward where it's not supposed to, and that's called our cranial drawer sign. If I feel that, I'm pretty sure we have a ACL or a cranial cruciate ligament injury. Then we x-ray the knee. That helps confirm it as well. Once we've diagnosed the cranial cruciate injury, they usually go to surgery. There are very few dogs, these little tiny dogs, that can get away without surgery. If you don't do surgery, they're going to have chronic pain and arthritis the rest of their life. There are lots of different surgical procedures. Sometimes your regular veterinarian can help you with surgery. If not, they will send you to a specialist, an orthopedic surgeon that can take care of it. Again, we're not going to go into all the different surgical procedures. We just need to know that surgery is going to correct the issue. Post-operatively, you have to be prepared. These animals have to be contained and under strict rest for anywhere from 4 to 6 or 8 or even sometimes 12 weeks, depending on the procedure that they have done. Some animals will need physical therapy when they're done. Most of these animals will need to be on some form of anti-inflammatory, initially either pre-op, post-op, and sometimes long-term to prevent any complications. So again, it's a very common injury of dogs. It is usually corrected surgically. It's easily diagnosed by your veterinarian, and most dogs after their surgery will do great for the rest of their lives. If you don't have surgery, we need to be prepared for a dog that's going to be in significant pain and develop significant arthritis.